Okay, thanks for sticking around on the post show here. Ed is back at the table along with everyone else. So Ed, let's, as I try to get up to speed here, because I left my iPad on the wrong side of the room, help me get up to speed on what you've been seeing online.
Well, two things that came, throughout the night on Twitter that I think we could be some, we could address was one, that kudos to the Springfield library system. How more can libraries and other places like community centers can play a role?
That's not, I mean, as best I understand, that's nothing anyone asked them to do. I mean, this is not a provision in the law. Your library shall, and they've kind of taken that initiative.
So a compliment. That was a really outstanding. And the other was actually on Facebook. Brett had mentioned, how do we get young people, this is a critical thing. We've been hearing it over and over. So how do we get them? What's the incentive? How do we do it to get them part of this? It seems like that's a big role.
Can we? What do you think?
Well, one thing survey literature tells us is they listen to their mothers. So I think we need to get their mothers talking to them about the importance of health insurance and taking care of their health.
Yes, ma'am.
Point.
Yeah.
And their sisters. We listen to our sisters too.
Your sisters too.
Yes. Okay. Let's keep that going. I'm curious. I mean, what are you hearing in your reporting? You're a young person. Are your fellow young people going to sign up for this? We're counting on you.
I think what a lot of young people are doing are staying on their parents' insurance until they're 26.
Yeah.
So, I mean, that is an important part of the Affordable Care Act. It's what I'm doing, that's for sure, until my parents decide to kick me off, which hopefully they won't. But yeah, that's, of my friends and people that I talk to my age, that seems like the popular thing to do, unless they have gotten some employer insurance.
But I think it's very important, because staying on, when you get to 26, it's going to be a big decision to drop off. It's not going to be like not getting on in the first place. You're on, and suddenly you're 26, you're dropping off, and you begin to think, maybe this isn't a good, maybe I'm not invincible. Maybe this isn't
you becoming accustomed to having insurance.
Yeah.
I think another point I'd like to make is that there's been a lot of effort put into social media in the campaign. I know the administration's been spending a lot of time on that and putting a lot into the ads into this. The other point I'd like to make, we know from the experience in Massachusetts, I just will make a prediction that we should not underestimate how much people really want insurance. We've been hearing that there's been about 8 million hits or so on healthcare.gov. I will probably say that, some of it is us. I was on there 12 times the first day. But I think,
you can only vote once.
Yeah, I think that these 50 million people that have been uninsured really want insurance. And we've gone through the recession and such. So, I think, we saw that in that video from that woman. I think people really don't like the risk of being without insurance. So I think, young people are, they were pretty fearful of being hit with those bills and medical debt. I know Sydney's done some research on that.
And we know you've also done a show on young people and the young invincibles, and I think young people are starting to talk to each other. My law students have been going out in the community and doing talks to other young people. They've talked to over 2,500 people in the last year, telling them about the Affordable Care Act and these new opportunities. So I think this is social media. This is what they're going to see on the sitcoms, on The Daily Show. And getting the word out there.
Yeah, and a lot of the young people that you're talking about, if we start talking about 27 years old and older, some of them are parents, and they have children that really should look into the health insurance marketplace, because through the health insurance marketplace, families are also able to see if their children qualify for CHIP, which is a special part of Medicaid. They would want their kids to be covered. So,
Mark, you start to say something?
Yeah, I was going to say the other thing too is that as penalties increase over the next several years, that may also be a driver for bringing people back into wanting to purchase insurance, and that starts to increase their tax bill.
Yeah, I mean, young people, you cheat on your amount of tips that you make at the bar or whatever, you're not going to be worried about $92, I don't think, as a penalty. That's roughly what it is the first year.
95.
Okay.
Yeah, they don't see the money coming out of their check for their taxes anyway. They're not going to miss it when it's $695 either, versus the premium of a $217 for a 27-year-old for a bronze level plan. So that will be their
Although,
choice.
What happened in Massachusetts when they instituted their penalty was right before the penalty went into effect, they had a lot of young, healthy men sign up for health insurance, just right before that deadline.
If I might add, I know Massachusetts gets thrown out there as the success story, but we're not for the $26 billion that all of us paid to save that state, save the state, because the school districts and the municipalities were ready to declare bankruptcy.
I think I need to get my pen for next show, for another show topic that you just gave us here,
So
because I don't know.
why is that always thrown out there?
I don't
as a
know. I think that's
success?
why-
Because
that's why we'll tackle it at another
It's an
time.
abject failure, though.
I'm not trying to blow you
Yeah.
off. I'm just saying I think
Yeah.
in the interest of trying to inform about the marketplaces as they are in Missouri, I don't think we can answer that in the limit the time that we have here.
About 3 shows. Massachusetts alone is 3 shows in and of itself.
Yeah.
So.
I think Bill makes a good point that there are some parts about Massachusetts that don't apply here, but the point I will make is there's some aspects of behavioral economics we don't really understand. Well, I think we do understand, and I think Sydney makes a good point that we may think that a $100 penalty, we wouldn't think people would respond well to this, but what we're learning from behavioral economics is people don't want to just throw away $100 for no reason.
More psychological than
It's very
financial.
psychological. They'd say, if you think about it, why throw away $100 to get nothing when you can spend $1,000
Get some
or
goods-
$500
goods and
and get
services.
insurance for it. That is actually a fairly rational, logical decision,
Yeah.
and that's what we've been learning from behavioral economics and other literatures.
They don't see it. It'd be one
I think
thing.
they do see it,
It'd be
but
one
that's
thing
my
if they
point.
wrote a check. It'd be one thing if we all wrote quarterly checks to the federal government for our taxes. We would have a revolt. But they don't write a check. It comes out of their tax return. They don't even see the money.
But wouldn't you want to get insurance for $500 than get nothing for $100 or $500? That's
We will
the point.
find out soon enough, I
Yeah.
suppose. I want to go back to you because we just kind of on the air barely touched on the expansion of Gateway to Health. Can you? I think this is something that a lot of people don't know about.
Right. Yeah. Gateway to Better Health was intended to be a pilot project. It's a grant. Really is. So that people who are under 100% of poverty would have better access to health care, because Medicaid did not expand in the state of Missouri, and this is only applicable in St. Louis. So it was supposed to be a stopgap as well as a pilot project. One of the things that we have seen with Gateway to Better Health is that when we first rolled it out and people signed up for it at Grace Hill, immediately we saw people that had been holding their prescriptions, for example, that hadn't come to see the doctor for a while, starting to keep their appointments, started to, take care of their health. So over the past year or so that it has been in place, we have seen improvements in the health of our patients, simply because now they can afford their prescriptions, they can afford their primary care visits as well as their specialty care visits. So, as a pilot, I think that has already demonstrated that access to care does really impact the health status.
And does it impact the rest of us in some? We've talked about on this show before that that's not just taking care of one person's health, but it's an investment in a larger quality of the community.
This is the big unfinished business of the Affordable Care Act, in Missouri at least, because as Sydney mentioned earlier, there are going to be about 300,000 people that are a gap in a safety net, and it's wonderful what People's Clinic is doing, and the Gateway to Health is going to fill that gap for a short while, but believe me, we really need to do something about Medicaid expansion, because what we didn't do in Missouri last year is huge. We turned away about $1.5 billion this year, and that's gone. And we need to we can get $2 billion a year if we do it this year, and we can cover 300,000 people if we do that. And that's $2 billion, just like a helicopter drop into into the state. And we know this economy is just stagnant right now. And we are losing jobs in this state. And if that $2 billion could be 24,000 jobs that's been reported from a University of Missouri study. And we are losing, now it's maybe several hundred jobs in this state because we're not doing this. And that's hurting healthcare providers and a trickle effect on others. So this is real people that are not getting insurance, and that's what's going to happen. So the legislature is going to deal with this issue. There's been interim committees working on this issue, and this is just a stopgap situation that Yvonne's dealing with it, and I think they're heroes for dealing with this, and I'm so glad that CMS continued that thing. I'm sorry to get very passionate about this, but these are people under the poverty
and
line.
it's important people to come and enroll, because there are still available spots, and there are still so many people who live under 100% of poverty. At Grace Hill alone, we have 10,000 uninsured people who are under 100% of poverty. And reaching them, when you're talking about social media and things like that, people who are poor don't have access to social media, computers, things like that. So we have to go canvass, knock on doors, talk to churches, talk to, really one-on-one. And everybody who's listening tonight, everybody who's here at this table, please, tell people that they can come to Grace Hill any day, whenever we're open, and we will help them enroll into Gateway. We will also help them. We have certified application counselors with the health insurance marketplace, see if they qualify for the subsidies or whatever they might qualify for. So we're here to help the community, whoever they are.
Last word.
Okay, I wanted to say as a follow-up, if the greatest challenge is getting more people into the system, I think the follow-up challenge is getting people to care for them. Because if you're going to reduce Medicaid reimbursements and tell doctors you have to take care of more patients for less money, you need to find the incentives to get the doctors to still go into primary care. And I think there's a lot of great organizations out there who are doing what they can, but I think the bigger challenge is over the long term, getting enough primary care providers into the system to take care of. If we do get more people in, we need to take care of them. We need to give doctors incentives, doctors and nurse practitioners incentives to care for these people.
And remember that the Affordable Care Act raised reimbursement for primary care. It's increased loans and grants to get more doctors, more nurses, more mental health professionals, more public health workers.
Nurse-run clinics.
Nurse-run
But
clinics.
then lowered hospital reimbursements. So do you know what's happening with the doctors right now?
Okay, let me.